Hi, Emma. Can we talk about the liver today? I'm curious about its structure and function.
Of course. The liver is an unpaired organ weighing about 1.5 kilograms. It's located in the right upper quadrant of the abdomen, just below the diaphragm. The liver is connected to the bile duct system, which plays a crucial role in digestion.
What are the main parts of the liver?
The liver consists of several parts, with the most notable being the right and left lobes. The left lobe extends to the left of the midline and sometimes reaches as far as the spleen, wrapping around the stomach. There are also smaller lobes, such as the quadrate and caudate lobes.
How are these lobes different from each other?
The lobes are not only structurally distinct but also functionally separated. They have unique vascular supplies and bile duct connections. The right and left lobes are separated by the Cantley's line, which runs through the gallbladder fossa and the inferior vena cava.
What about the peritoneal spaces around the liver?
Surrounding the liver are several peritoneal spaces, including the subhepatic space and the subdiaphragmatic space. These spaces can sometimes accumulate fluid, which can be an indication of various medical conditions.
Can you explain the significance of the ligaments associated with the liver?
The liver is held in place by several ligaments. The most notable ones include the ligamentum teres hepatis, which is the remnant of the umbilical vein, and the ligamentum venosum, a remnant of the ductus venosus from fetal circulation. Other important ligaments are the falciform ligament, which attaches the liver to the anterior abdominal wall, and the coronary and triangular ligaments, which secure the liver to the diaphragm.
How do these ligaments contribute to liver function?
These ligaments help maintain the liver's position within the abdomen, ensuring it doesn't shift with body movements. They also contain important blood vessels and bile ducts that are essential for the liver's function.
What can you tell me about the vascular supply of the liver?
The liver has a dual blood supply, the hepatic artery and the portal vein. The hepatic artery provides oxygen-rich blood, while the portal vein brings nutrient-rich blood from the digestive organs. This dual supply is crucial for the liver's metabolic and detoxification functions.
How does the blood flow through the liver?
Blood from both the hepatic artery and portal vein enters the liver at the porta hepatis. From there, it flows through the liver's sinusoids, where it is processed by hepatocytes. The blood is then collected by the central veins of each lobule, which merge into the hepatic veins, and finally drains into the inferior vena cava.
What about the bile ducts?
The bile produced by the liver is collected by a network of bile ducts that eventually merge into the right and left hepatic ducts. These ducts join to form the common hepatic duct, which then combines with the cystic duct from the gallbladder to form the common bile duct. The bile is transported to the duodenum to aid in digestion.
Can you explain the concept of liver segments?
Sure. The liver is divided into 8 functional segments based on its vascular supply. These segments are important in surgical procedures because they allow for precise removal of diseased parts without affecting the rest of the liver. Each segment receives its own blood supply from the portal vein, hepatic artery, and bile duct.
Why is this segmentation important in surgery?
Segmentation allows surgeons to perform partial hepatectomies, removing only the affected segments. This is particularly useful in cases of tumors or other localized liver diseases. By understanding the segmental anatomy, surgeons can minimize damage to healthy liver tissue.
This has been really informative. Thank you, Emma.
You're welcome. The liver is a fascinating and complex organ, and understanding its anatomy and function is essential for both medical professionals and students.